All right, if you're watching this, it probably means that ear tube surgery has been recommended for your child, or you're trying to understand whether ear tubes might be the right next step. So I want to walk you through the basics. We'll talk about the anatomy of the ear, how the ear is supposed to work, what goes wrong when children get repeat ear infections or persistent fluid buildup behind the eardrum, why ear tubes are sometimes recommended, what happens on the day of surgery, and what to expect afterward. The goal is to help you feel more comfortable, more informed, and hopefully a little less anxious about the whole process. So let's start with the anatomy. The ear has three main parts: the outer ear, the middle ear, and the inner ear. The outer ear is the part that you can see along with the ear canal. Now, sound travels through the ear canal and reaches the eardrum. The eardrum is a thin membrane that vibrates when sound hits it. Behind the eardrum is the middle ear space. This is a small air-filled space that contains the three little bones of hearing: the malleus, the incus, and the stapes. Those bones help transfer sound vibrations from the eardrum into the inner ear, where the hearing nerve itself sends those signals to the brain. Now, for the eardrum and hearing bones to work properly, the middle ear space needs to be filled with air. It shouldn't have fluid in that space. That's where the Eustachian tube comes in. The Eustachian tube is a small tube that connects the middle ear to the back of the nose, and its job is to let air into the middle ear, help equalize the pressure, help fluid drain out of that space if it collects, and keep the pressure overall equal to the outside world. Now, in adults, the Eustachian tube tends to work better because it's longer, it's more angled, and more mature. In children, the Eustachian tube is shorter, smaller, and more of a horizontal position. Now, because of that, it does not always ventilate the middle ear as well. It can often become blocked or swollen more easily during colds, viral infections, allergies, or nasal congestion. So when that happens, the middle ear does not get enough air, doesn't ventilate. And if air cannot get into the middle ear, pressure builds up, fluid can collect behind the eardrum, and bacteria or viruses can grow in that fluid. Now, that's what can lead to ear infections. When a child has an acute ear infection, there is infected fluid behind the eardrum. The eardrum may become red, swollen, painful, sometimes bulging when you look at it. That pressure is often what causes the pain, the fever, fussiness, poor sleep, decreased appetite the parents notice. Many children have one or two infections and clear up and then do fine. So that's typical. Some children, however, get repeat infections. In those children, the problem is not necessarily that the antibiotic didn't work, but the bigger issue is that the middle ear is not ventilating normally. So fluid keeps building up or really never clears after an infection. Ear tubes are commonly recommended for two main reasons. The first is recurring ear infections. So in general, we start thinking about ear tubes when a child has had frequent infections, such as 3 or more in 6 months, or 4 or more in 12 months when one has been within the past 6. Now, an important point here is that current recommendations are that there be fluid behind the eardrum at the time the child is seen for evaluation. So if your child has had repeat infections, but the ear actually looks clear at the time that they're seen, tubes may not be recommended at that time. In that situation, typically it's recommended to wait a little bit longer, potentially have them even return when they have an infection. Now, the second common reason for ear tubes is persistent fluid behind the eardrum. This is called an otitis media with effusion or middle ear fluid. The fluid is not always infected, and sometimes the child doesn't even know that it's there. Now, that's a concern because in young children, hearing is important. In a child's speech development, they're, of course, learning sounds, words, pronunciation, attention, and communication. And if their hearing is if they're underwater for months at a time, that can obviously affect speech development. It can also affect school performance, behavior, and overall quality of life. So for persistent fluid, we often confirm the problem with an ear exam, sometimes what's called a tympanogram, and then a formal hearing test if it's possible. If fluid has been present there for 3 months or longer and there's documented hearing difficulty, ear tubes are commonly recommended. Tubes can also be considered with chronic fluid associated with other problems like balance issues, generalized discomfort, maybe poor school performance, behavior issues, and reduced quality of life. Now, sometimes we do observe first. If fluid has only been there for a short period of time, many children will clear it on their own. Depending on the situation, we may watch it for a short time, often around 3 months, and then reassess. Allergy treatment or other nasal sprays may be considered in select children, but those treatments don't necessarily clear the middle ear fluid, at least according to studies. So what do ear tubes do? An ear tube is a tiny little tube placed through the eardrum to ventilate the middle ear space. Instead of relying on the child's Eustachian tube to ventilate the middle ear, The tube allows air to pass directly through the eardrum into the manular space. That helps equalize the pressure, allows fluid to drain or stay cleared, and can improve hearing when the hearing loss is caused by the fluid itself. It can also make future infections easier to treat. If a child gets an ear infection with tubes in place, the infection typically drains out through the tube into the ear canal. That drainage can look concerning, but it actually tells us that the tube is doing its job. In most cases, those infections are treated more easily with the antibiotic ear drops instead of oral antibiotics, fewer side effects. So let's talk about the day of surgery. What happens? Ear tube surgery is typically done in an operating room or surgical center under general anesthesia. For most children, this is a very short procedure. It's commonly done with mask anesthesia, meaning that your child breathes anesthesia going through the mask. Most children don't need any IV for straightforward ear tube surgery, though anesthesia plans can vary depending on your child's age, their health history, and the facility that you're at. When your child is safely asleep, the surgeon looks at the ear under a microscope. A small incision is made in the eardrum, typically in the anterior inferior front part of the drum. Then the tiny ear tube is placed through that incision. The tube usually looks like a small spool or bobbin. One side sits under the eardrum and one side sits on the outside. That helps keep the tube in place. Once the tube's placed, typically the surgeon will place some ear drops and then work on the other ear. Now, once the tubes are in place, the anesthesia is turned off and your child starts to wake up. The actual procedure itself is pretty quick. The total time away from your child can feel a little bit longer than that because it does include, of course, getting to the operating room, falling asleep, positioning, procedure itself, then waking up and going to recovery. After surgery, your child goes to the recovery room where the nurses monitor their breathing, their oxygen level, heart rate, comfort, and wakefulness. Most facilities try to reunite parents and children as soon as possible. Some children wake up calmly. Some wake up a little bit more confused, crying, and upset. That can be normal after anesthesia, especially in young children. It doesn't necessarily mean that they're in any discomfort, but typically more that they're just confused, disoriented, and tired, kind of sick of the whole situation. Good news is most children do great when they're back with their parents. They have something to drink and fully wake up. Now, pain after ear tubes is typically pretty mild. Some children may need ibuprofen or Tylenol, acetaminophen, rarely anything stronger than that. Many children are back to normal later on that day and certainly by the following day. You may notice a little bit of drainage after the tubes are placed. Typically, it's a clear, maybe yellow, or even a little bit red. A small amount of drainage is normal, especially if fluid was present at the time of surgery. And your surgeon will typically discuss that with you after. Now, while current guidelines don't recommend routinely prescribing antibiotic ear drops after surgery, to use at home, your surgeon may prescribe them, again, in certain situations, depending on what was found at the time of surgery. If ear drops are prescribed, use them as directed by your surgeon. A helpful technique is to actually warm them in your armpit for several minutes before use. It helps bring them up to body temperature and they're more comfortable. I typically recommend gently pulling the ear up or back, placing 2 or 3 drops in the ear canal, then pushing on that little plunger in front of the ear called the tragus. Push on that 2 or 3 times. Follow with 2 or 3 more drops, again pushing on the tragus. That helps push the drops into and through the tube into the middle ear space. Now, if your child develops ear drainage later on, several weeks later, then typically you can actually use those same drops that were used after surgery. Again, typically this resolves on its own with those topical drops and you don't need oral antibiotics. Now, a common question that parents might ask, can my child swim after having ear tubes? For most children, the answer is yes. Current guidelines recommend letting kids swim and do not worry about using earplugs, headbands, or things like that. Studies have shown that the benefit of routine water precautions is extremely small, so you just don't need to do it. For most children, they can swim, especially in treated pools, without any special precautions. Now, that said, nations can be individualized. Some children may do better with earplugs. For instance, if they get recurring ear drainage after swimming, if they like to swim in lakes or ponds, maybe untreated water, or if they like to dive deep, then earplugs may be recommended. Water precautions are also reasonable during an active ear infection when there's drainage. But for the average child with tubes, routine water restrictions are not necessary, so let them swim. Bathing and showering are also fine. It's generally recommended, of course, to avoid water shooting directly into the ear, and maybe really soapy bubble bath water might be avoided, but normal bathing is not a problem. Now, after surgery, follow-up is important. Your surgeon will typically want to visit with you and your child within 1 to 3 months after surgery just to make sure that the ear tubes are open, they're working, and then periodic follow-ups after that are typically recommended until the tubes come out. Now, it's important to remember that tubes are temporary. Most short-term tubes fall out on their own as the eardrum heals eventually kicks them out. This commonly happens somewhere around 6 to 18 months after they're placed, depending on the type of tube and the child. Now, when the ear tube comes out, the eardrum typically heals on its own. In a small percentage of children, roughly 2 or 3% with short-term tubes, a tiny hole can remain after the tube comes out. Typically, this is watched for several months, but eventually may need repair. As a rule, most heal on their own without needing anything else. Now, most children only need one set of tubes. I like to say that they're one and done. Some children, however, especially younger children or children with ongoing Eustachian tube problems, may need another set of tubes. Now, let me bring up a few things that aren't normal and to be aware of that you would want to discuss with your surgeon. If your child's had ear tubes and they've got persistent drainage over several days after the surgery, maybe worsening pain, high fevers, dizziness, swelling in and around the ear, or things just aren't quite right, that would be a time to reach out to your surgeon. But overall, ear tube surgery is one of the most common procedures performed in children. It's short, well tolerated, and for the right child, it can make a big difference in infections, hearing, sleep comfort, speech development, and overall quality of life. So let's summarize. Ear tubes are used when the middle ear is not ventilating well. They may be recommended for children with recurrent ear infections when fluid is present at the time of evaluation, or for children with persistent middle ear fluid that is affecting hearing or causing other problems. The tube creates a small temporary airway through the eardrum, allowing the middle ear to ventilate. The surgery itself is brief, usually done under a mask anesthesia, and recovery is typically quick. Most children return to normal activity quickly. Most can swim without routine earplugs, and future infections can be treated with ear drops instead of oral antibiotics. As always, your child's specific situation may be a little bit different, so follow the instructions given to you by your personal surgeon and surgical team. So now he knows. Thanks for watching.